I've been a periodontist for 38 years, and I was looking at the LANAP laser, the PerioLase, for a couple of years, and then 4 years ago I bought it and I've been using it ever since and been very happy. Periodontics doesn't have a lot of technology other than digital x-rays. It's more human, meaning we employ dental assistants and hygienists and traditional office practice. But this was not only technology, but it was expensive technology, and I wanted to make sure that it was something that was going to work. I had previously bought a laser back in the early 90s, which was strictly for aesthetics and aesthetic surgery, and I ended up putting it in the closet. I used it like 3 times and never used it again. So this time I wanted to make sure that I didn't purchase something that the same thing would happen. The reason I chose PerioLase was because A, it had the most research, B, colleagues of mine and teachers of mine were saying terrific things about it, and that meant a lot to me in terms of trust. And even though it was the most expensive laser, I felt that when I buy something, I want the best. I don't want a knockoff. I don't want somebody that says, oh, I can do it just as well, and it's like, you can save $20,000. That's not where I'm at. If I'm doing it, I want the official laser. And so, again, even though the expense was higher, it was well worth it, and it certainly pays for itself, there's no question. This laser has been a big change in my practice, has offered a big change in my practice for so many reasons. Traditional periodontics involves deep cleanings and usually periodontal surgery and bite adjustments, but some of it can be as gentle as we think we are. It can be painful afterwards. There could be swelling, there could be bleeding, there could be black and blue, and patients are sore and they're afraid and they're frightened of what their friends and relatives have gone through. So after 34 years of traditional perio, I've now incorporated the laser with that. Even in the explanation of what I'm going to do for someone, I don't have to explain nearly as much. The consultation is much shorter. All I have to say is, we can do it traditionally with surgery and sutures and cutting and grafting of bone, or we can use a laser where there's no pain, no swelling, no stitches, no cutting, no bleeding, and they say, okay, I'll do that. That's the end of the consultation. So it's been great. Especially the patients that have had conventional surgery first, because I've been in Manhattan for about 33 years. So I have patients where the disease comes back. It's a disease. It's not a one-time fix, conventional work. And so they may now need this, and they'll go, oh, I'll try that versus the surgery you did for me 10 years ago. And they're amazed. With regular surgery, they come back a week later to take out their sutures. With the LAPIP or LANAP, I have them back at the 2-week mark because there's nothing to take out. And I ask them the same questions all the time. How'd it go? How'd you feel? Was there any discomfort? Was there any swelling? There hasn't been one patient, and it's got to be at least, performed at least 400 to 500 different procedures with the laser. Not one person has had discomfort. Everyone is like blown away at how comfortable they are afterwards. They would never do it any other way. They're so appreciative, and the word spreads. And what I did was I picked a woman that I had been treating for a while. She had a tooth that was sent to me to be extracted. So I said to her, give me a try with this laser. It's brand new. I've done it in the course. I feel confident. It's not a difficult learning experience. And there'll be no pain and no bleeding and no swelling, etc. And it's slated for extraction anyway. If it doesn't work, I'll take your tooth out at no charge. So you won't even have a financial burden of 2 procedures. I got about 90% of the bone to grow back. So much so that when I sent the x-ray 6 months later back to the dentist, he thought I sent him an x-ray from 10 years ago, before the bone loss. And he was blown away by it, and he is a believer and sends me a lot of patients that need this because he saw it with his own eyes, and she saved her tooth. So not only didn't it hurt, but it was no more expensive than taking her tooth out, and we saved her tooth. We have ways now using the laser to, A, treat people that are on specific medications or certain diseases that you couldn't treat before. So people on blood thinners, you can now treat because you get a clot from this, whereas before I'd have to ask the permission of their physician to take them off that medication, so 3 or 4 days, so I could do my procedure and they wouldn't be bleeding. It's a leap of faith. It's a leap of faith that this light beam is going to create dental health, but it does, and it's been great.